Welcome to the LDN radio show, brought to you by the LDN Research Trust. I'm your host, Linda Elseygood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose Naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. This show is sponsored by Mark Drugs, who specialise in the custom compounding of medications, assuring that the client gets the proper prescriptions for their unique needs and conditions. They work with practitioners, integrating knowledge and treatment of experts to create comprehensive health plans. Visit markdrugs.com or call Roselle 630 529 3400 or Deerfield 847 419 9898. Today I'd like to welcome my guest, Dr. Leonard Weinstock. He's a gastroenterologist from Missouri. Thank you for joining us today.
Welcome.
Well, I think you're going to explain to us about mast cell activation syndrome, and you were telling me that it's quite an epidemic now.
You know, an epidemic means a couple different things. One of it is an epidemic that more people are being recognized with this disorder. And I've actually spent a fair amount of time discussing it in the chapter that I wrote for the new LDN book, the second LDN book. And I think it's actually the first time that this subject has been in a book with discussion of LDN. In fact, I can tell you that for a fact. Mm-hmm. So, and it's made an enormous change in my practice.
So how does somebody know if they have mast cell activation syndrome? What are the symptoms?
Well, it's a disorder of these aberrant, poorly controlled, hyperactive mast cells, which are one of the white blood cells in our body, that causes symptoms in numerous parts of their body. And this cell normally orchestrates good immune function, orchestrates how things heal, normal blood vessel supply to, let's say, deal with a burn or a trauma event or a broken bone. These things that come out of the bone marrow normally and go to the sites where there's inflammation. And then it basically becomes the conductor of the orchestra to say, okay, you guys do this, you guys do that, and all the immune cells and chemicals behave in the correct manner for the body to heal itself. But when the mast cell, stem cell in the bone marrow develops a genetic change, which then becomes permanent, every time it activates and the little mast cells that come from the stem cell go out into the body, whether it be the gut, the skin, the nose, the bladder, the vagina, the prostate, and then takes up residence, it will result in problems. Also add the fat, the body fat, to that list. And then creates problems by releasing up to 200 chemicals or more anytime it wants to, or activates because of a variety of triggers. And that could include the food that we eat, the common ones being gluten, dairy, yeast, and histamine foods, including tea, coffee, chocolate, sardines, cold cuts, other things, including processed meats. So these things can activate mast cells. The other things, there are a variety of triggers that occur during a person's life that will activate, and I'll just talk about that in a minute. But I do want to say that this is a congenital disorder. You inherit some abnormalities to some of the stem cells in your bone marrow from your mother or father. And often there's a family history in these patients of diseases and syndromes that nobody's ever been able to explain. So the mother of my patient may have fibromyalgia or chronic migraines, or be a sickly person in general throughout their whole life, going for decades and decades. And what happens is the baby picks up that genetic abnormality. A variety of things that can occur in those cells, and then you start having some active symptoms as a baby, and that includes colic. And this is totally a condition that's so common, but totally unrecognized by pediatricians that this could be an explanation for colic. And food sensitivity, rashes, eczema, migraines, headaches, constipation, sensitive gut, as one patient just told me the other day, always had a sensitive gut. Irritable bowel syndrome, again, that's a syndrome. We hate that word, I do, because it is something that is, quote, idiopathic. The doctors don't know what's causing it, but we really need to think a lot harder. And then patients, as young kids, could have sensitivity to mosquito bites. They can have big reactions to bites. They could have severe asthma or allergies, which then can go away. And it may be at that point that there's some decrease in the activity of the mast cells, stem cells for some reason. But then when a person reaches puberty, often things get worse with hormonal triggers. And these are the people who complain of severe menstrual periods, taking them out of school, severe cramps, severe bleeding. And recently, Dr. Afrin and others reported use of Benadryl or diphenhydramine douches or suppositories to reduce this, with marked improvement in mast cell activation syndrome patients. And then during the teenage years, there's a lot of stress. Stress activates mast cell activation syndrome. Maybe that's a contributing factor to acne as a teen. Then as we go into adulthood, there are a lot of consequences of the stress, the inflammatory stress of pregnancy, which can activate mast cell activation syndrome. I also, and others, call this MCAS, so I will then talk about MCAS as the condition. Other conditions such as reaction or autoimmune changes to vaccines can play a role. I have patients who are remarkably sensitive to heat. One woman goes out in the hot temperature of Missouri, and her temperature goes to 103, and her face gets red and puffy and swollen. She literally rolled into my exam room in a wheelchair, and with the use of low-dose Naltrexone and other simple medications, walked in the next time she came in. And that was really a heart-wrenching, but a gratifying situation for me to see. And she's made significant improvements. So I do utilize LDN. A number of my associates who in different parts of the country use LDN as one of the first steps in treating this condition. The condition is normally treated by the use of antihistamines such as famotidine and sertrazine, but others can be used. Usually we use those twice a day, and you want to use the loratadine or sertraline or others twice a day because they're non-sedating. They don't get into the brain. You want to also use vitamin C and D, which stabilize the mast cell and are very common. It's important to use enough D to cover your levels and try to get up to a high level, which is therefore anti-inflammatory. You also want to use the sustained release form of vitamin C. There's less acidity by taking that, and also you don't get dips in your blood levels. And so the sustained level is also important. The level of low-dose naltrexone, I generally start with 1 milligram and work my way up. In terms of diagnosing somebody with this disorder, they have to have 2 or more classic mast cell activation symptoms. And that could be simply irritable bowel syndrome and stuffy nose. I have patients who have had limited symptoms like that, and they reverse and turn around just with simple over-the-counter therapy. They don't even need the LDN. But those who are more effective, and there are plenty of my patients in that regard, do well with LDN. And if you buy the book in my chapter, you will see my outcomes data for patients who are treated with LDN. And it's dramatic in some patients, especially some things like brain fog, which is so common. People can't remember words. Their abilities to work are really destroyed. There's another neuropsychiatric problem with mast cell disease. There can be so many things that affect the body, including the brain. And I'll go into that in a bit and tell you about a few cases. But I do want to finalize things about the diagnosis. We do like to get the chemical analysis, the mediator tests that help prove that somebody has mast cell activation syndrome. So that would include their heparin level, which is unfortunately only available in some labs to be done in the ideal ultrasensitive way. That would be 60%. But the fact is, in the United States, there's only one lab that I know of that does this correctly. And in Germany, there's a lab that does it as well correctly. The next most common positive blood test is the prostaglandin D2. About 37% of my patients have it, as do 37% of my patients who have the elevated chromogranin A level. Then the histamine level is positive in about 15%, 20%. Tryptase level, which is widely misunderstood by allergists who deal with this condition or other doctors who think they're dealing with MCAS correctly, and they say, oh, if the tryptase is normal, it excludes it. Well, the fact is they're wrong. 85% of MCAS patients will have normal tryptase levels. Then there are 3 urine tests that can be run. Some people also believe that if you repeat the tryptase level during an attack, a significant elevation could be significant. The data to support that are not in the literature and are a problem because following this guideline could result in getting underdiagnosed and therefore undertreated. So I am investigating a number of conditions that are associated with mast cell activation syndrome, and just recently found that 40% of my patients had restless leg syndrome, 60% had ringing of the ears, and 30% had small intestinal bacterial overgrowth. bloating is a very common symptom of MCAS, and therefore bloating, especially immediately, spontaneously, is likely due to the effect of the mast cell mediators or chemicals, as opposed to small intestinal bacterial overgrowth, or SIBO. This is an epidemic, if you will. The range and estimates are 1% for the United States, and 17% of the German population has been estimated to have mast cell activation syndrome. So something's going on with our genes that allow these changes to occur early in the life, whether it's methylation problems, whether it's radiation, I don't know, but I think all these things need to be explored. I have patients who got a lot worse when they moved into a new home and the entire block had radon in their basements, and they all had to get fixed. And that radon is a naturally occurring nuclear material. So I think a lot of work needs to be done. We need to live in a healthier planet, and God willing, that will take place. And pray for the Australians, and do whatever you can to help find a control. Thank you, Linda.
Oh, thank you. Wow, there's a lot of information there. So if somebody is concerned, thinking they have mast cell activation syndrome, how easy is it to find a knowledgeable doctor who would know about these tests you were talking about?
Amazing, great question. The answer is very difficult. Now, you introduced me to a doctor in England who's interested in expanding her functional medicine. I'll be talking to her in a few hours. This has got to start in medical school, because otherwise this is going to take 20, 30 years, and think about all the suffering to go on. There's a minority of people. We have a study group that has 160 doctors. It's grown from 30 doctors in a matter of 2 years to 160 doctors who are actively engaged with this, studying MCAS, sharing difficult cases, getting ideas, and it's been a wealth of information. And the leader is Dr. Lawrence Aspern. He has writings. You can see YouTubes on mast cell activation syndrome, and there are a number of good ones out there. But, you know, it takes doctors a very long time to learn anything new. Only if there's a drug that comes out, which is then FDA approved or approved by the EU for a particular disease, does it actually have the potential of getting out there, either through articles or, believe it or not, through drug representatives who are then able to come in, advertise the drug, advertise the disease or syndrome. But even that takes a long time. I mean, since 2015, we have two IBS drugs that were FDA approved. One of them is Xifaxan, the other one is a supercharged Imodium Viberzi. And many of the GI doctors and primary care doctors don't know about it or understand it. And again, it wasn't taught in medical school, so it wasn't taught in your residency. And many doctors, I'm afraid, don't learn anything new just because they're overwhelmed by other things, and it's a problem.
Well, as you can perhaps remember, when you suggested I had a SIBO test, how impossible it was for me to try and organise that. And I was thinking while you were talking, I really wouldn't know in England how we would go about having these tests. But if you're going to be talking to this doctor later, maybe she will take it on board and learn about it. So
So, I
a
mean,
small start.
theoretically, the allergists know about it. Linda, theoretically, your allergists in the UK or elsewhere know about mast cell activation syndrome.
Okay.
One of the problems is politics. Once you make the diagnosis, then everybody, their GP wants you to manage the patient. Now, these patients can have 48 different symptoms in 11 different parts of the body. And they're a lot to handle. They take more time. Once you tell the patient, okay, I believe everything you say, and I believe that everything is due to one little cell in your body, then the patient is validated. Finally, they don't feel crazy. And honestly, that's a big thing.
Mm-hmm.
And C, the doctor who diagnoses it winds up being the treating physician and spending a lot of time by emails, phone calls, etc. And so a lot of the doctors who are on our internet study group are actually what we call private or concierge type doctors who can spend an hour, hour and a half with the patient. And in the insurance model, that, or especially in your model that you have in the United Kingdom, that's hard to do, if not impossible.
Well, it wouldn't fit in 10 minutes, would it?
No, not in 10 minutes.
No.
No, that's the problem. No.
Yeah. So if you manage... Sorry.
Go ahead.
If you manage to find somebody who would diagnose you, give you the tests, diagnose you, what is the treatment? I know you said about LDN and cutting out LDN, all the things in your body, in your diet.
Right. And I've got something online that they can look at as well. It's an educational handout that goes to diagnosis, education, basic treatment by the basic steps, step 1, 2, 3, 4, diet, symptoms specifically. So many of those are prescriptions, but not all. So on my website, gidoctor.net, so gidoctor.net, they can type in the search area mast cell or MCAS, MCAS, and see my approach, see some of the PowerPoints that I've given. These, for me, as a gastroenterologist, this has been nothing but a game changer. Nothing less than a game changer, because it helps me diagnose all the difficult patients that have been dumped, if you will, by this routine gastroenterologist, told that they're crazy. Or just given up, and they wind up seeing 3 or 4 more and don't get answers. They get colonoscopy twice or 3 times and biopsy, but if you don't stain for it, you're not going to see the cells. And if you don't test their blood in a special way, you'll never get the answer. So for me, this is a remarkable phenomenon. Mm-hmm. Remarkable. And it makes me feel good because I can take the most dramatic case, which was yesterday, where I have a patient that's severely affected, very severely affected, but she's getting better with aggressive medical therapy. But then I decided to ask her about her family history, and it wasn't quite clear. Yeah, her mother was affected by some problems. And then I said, well, what about your children? And she said, well, this is a big problem. And she became weepy. And she said, well, my daughter's had psychological problems all of her life. And when she was 16, she blamed me for this and that and moved out of my house at 16 and cut me off from her life, wound up moving in with the grandmother. And I said, this could easily be neuropsychiatric disorder related to MCAS. And if you Google MCAS and neuropsychiatric disease, you'll come up with Dr. Afrin and Dr. Muldering's report talking about all the disorders, including depression, anxiety, panic attack, even schizophrenia, things that are caused by chemicals, not by nature, but nature, not by nurture issues. And I said, to Mrs. G, I said, you got to take this paper to your daughter. You've got to take this questionnaire. And I believe the questionnaire is on my website, the MCMRS questionnaire, and take that and give it to your daughter and say, it's not me, it's my genes that you received. And this could get better with simple medications. And I told her about a 17-year-old woman that I saw who had panic attacks, and her eyes would glaze over, and she'd get with stress, panic attacks. She had to stay home from high school for a year to try to get herself in line. The mom saw me, was diagnosed with MCAS, and she pleaded, could I see her daughter who had panic attacks, because she read about panic attacks in the literature I gave her. And I saw her, a very nice person, and not a lot of systemic symptoms that she would admit to, but she had this severe nature of being nervous. And so I gave her Naltrexone, I gave her antihistamines, I had her come back for a follow-up. Her blood tests were actually negative for MCAS, but that doesn't rule it out. Good 25 to 50% of people are going to have negative blood tests. And she came back in, and she was a new young lady. I mean, she was confident. She was smiling. I mean, it was amazing. And she was so happy, so thrilled. She was going back to school and going into college the next year. And things went great until college, when she had a terrible diet, couldn't keep gluten-free. And so she came in at Christmas time, and we talked about how she needed to modify her diet, some tricks, since that was the main cause for her slipping. So we had to look for triggers. But, I mean, that's one of the greatest feeling things that I've done in 35 years of being a physician.
That's a great story. You did actually have a request for people if they had abdominal pain. Would you like to tell us who you would like to contact you?
Yes. So I'm doing a research project trying to identify people with chronic abdominal pain who have had CAT scans of their abdomen and been diagnosed with one of three conditions: mesenteric paniculitis, inflammation of the fat; sclerosing mesenteritis, which is some inflammation and contraction of the mesentery of the abdomen, which is the connective tissue that holds everything in place; or the most serious of the three related conditions, namely retractile mesenteritis, where everything like moves in, pulls in, and fibrosis and scars down. So I'm looking for patients who have that, diagnosed by X-ray, and have been treated with the LDN for a variety of things, and have had found relief of their abdominal pain. So if you've got that, you can write to me at lw@gidoctor.net, similar to my website, LW, my initials, at gidoctor.net that's specifically looking for patients who have had benefit with LDN for their abdominal pain and had one of those three conditions, mesenteric paniculitis, sclerosing mesenteritis, and retractile mesenteritis. This is basically something that is more for a survey as opposed to coming to Missouri and seeing me. It's really for a survey. And then, I think that some of these patients are going to be like two of the patients that I've got in our practice that are related to mast cell activation syndrome.
Wow.
That's all I've got for you today, Linda.
Well, you're absolutely fine. You're just like 30 seconds off the end of the show. So well done you. And thank you very much for educating us today. And I do hope people will contact you.
My pleasure. Have a good day.
Thank you. This show is sponsored by Mark Drugs, who specialise in the custom compounding of medications, assuring that the client gets the proper prescriptions for their unique needs and conditions. They work with practitioners, integrating knowledge and treatment of experts to create comprehensive health plans. Visit markdrugs.com or call Roselle 630-529-3400 or Deerfield 847-419-9898. New for 2020, our LDN radio shows will be available on Spotify and iTunes. They will also be transcribed and added to our website, ldnresearchtrust.org. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.